A boy fell from a tree and sustained a penetrating wound to his axilla. He is able to extend and pronate his forearm normally, but flexion and supination are greatly weakened. Which nerve has been most likely damaged? In this question, the musculocutaneous nerve is the nerve of choice. Flexion of the elbow is going to be from the anterior flexor compartment of the arm. And supination is the job of two muscles, the supinator and the biceps. And the biceps is going to be by far the more powerful of those two as a supinator. So with weakened supination, there's only a couple options that can be missing. One is the bicep, the other is the supinator, and if it's greatly weakened, it has to be the bicep, which is also innervated by the musculocutaneous nerve. The axillary nerve does not cross the elbow. The median nerve does nothing before the elbow. The radial nerve is an extensor nerve, and the ulnar nerve is only going to supply a couple muscles in the forearm. A 57-year-old male is seen for radiating pain in the low back. A CT exam reveals a posterior lateral herniation of the L4, L5 intervertebral disc. Which nerve will most likely be affected by this injury? The instinct at this point is to know that the nerves of each vertebral level in the thoracic and lumbar region exit below the vertebrae that they're numbered after, whereas in the cervical region, those nerves exit above the vertebrae at which they're numbered. In this case, people are instinctively wanting to pick L4 as their answer, but there's an anatomic reason that this answer is actually L5. Let's discuss that. Here you can see the vertebral column with the 8 cervical nerves, 12 thoracic, and 5 lumbar. Remember their distribution so that the cervical nerves come out above and the thoracic and lumbar nerves come out below the vertebrae from which they're numbered, simply because 8 cervical nerves associated with 7 cervical vertebrae require that C1 come out above the C1 vertebrae. So if we look at the C4-5 disc, we look at the T4-5 disc, and we look at the L4-5 disc, and think about a herniated disc at each of those levels, what do we want to take away from this when we're dealing with questions for the step 1? If you look at the C4-5 herniation, remember the nerves are coming out right at the level of the disc, so any kind of herniation at that point will indeed compress the C5 nerve if it's between C4-5 because of the nerve traveling above the vertebrae. So therefore we have a C5 herniation. If we do the same thing at the T4, T5, because it's coming out right at the disc level again, but this time the nerves are numbered below the vertebrae from which they come out, now we'll see a T4 herniation. When you get to the lumbar regions, the L4, L5 herniation, you can see how high up the intervertebral notch is on the L4 vertebrae. That's because of the body being so much larger in the lumbar region than they are in the cervical and thoracic region. Therefore, there's enough space for the L4 nerve to exit from the intervertebral foramina prior to the disc. So the disc retropulsing at the 5 and 7 o'clock location will actually not compress the L4 because it's already exited above the level of the disc. That means that it's the next nerve down that's trying to angulate out and get through the next intervertebral foramina that's going to get the nerve root compressed by the disc. And here you can see the L4, L5 disc. You can see how the arch will be too high to compress L4, but the next one getting compressed will be that L5 nerve as it tries to exit. So this is one way you can logic through that. Or you can simply memorize the fact that if the nerve exits at the cervical level, it's going to be the bottom of the two. If it exits or retropulses in the thoracic level, it will be the top one of the two. And if it's in the lumbar level, it will be the bottom of the two again. Hopefully this will help you deal with these questions as they come into discussing the intervertebral foramina and the disc herniation. One last thing I want to put on your minds as far as the rotation and the movements. Remember, it's the facets that dictate the direction of movement. It's the intervertebral disc that dictate the amount of movement. Since the discs are bigger in the lumbar region, there's more movement at those levels than there are higher up at the cervical region where the discs are smaller.